Hello everyone, this is Jageshwar and I am the professor of psychology. So today we are going to discuss a topic of abnormal psychology. So let's begin. So this is basically a topic of psychopathology. So first we have to learn what is psychopathology and what it comes under. So psychopathology basically comes under abnormal psychology. Abnormal psychology, what means abnormal psychology? It is basically a branch of psychology that studies the unusual patterns of behavior, thought, emotions and feelings. Whatever the unusual things occurs within the individual, we study in abnormal psychology. So this is a branch of psychology that deals with abnormal behavior. So not only the abnormal behavior, but all the possible causes, etiology and symptoms about abnormal behavior. So next, abnormal behavior and abnormality. So the branch where we study about abnormal patterns of behavior, thought, emotions comes under abnormal psychology. On the other hand, what is abnormality or what is the abnormal behavior? So abnormal behavior generally is a behavior that deviates from normal. That deviates from normal simply means a behavior that is away from normal, or is there any difference or significant disturbance within the behavior. So any behavior that deviates from healthy behavior, any behavior that deviates from the ideal mental health is usually known as abnormal behavior. So abnormal behavior is generally defined as behavior that violates a norm in society, is maladaptive, is rare given context of the culture, environment, and is causing the personal distress in daily living. So the norms, the violation of social norms, the violation of cultural norms in society lead to abnormal behavior. So what is abnormality? So simply means away from normality or absence of normality. In a general or in a layman term, what we usually say, if a person is not performing the behavior as per the norms of society, as per the norms of the culture, if a person is showing some unusual behavior that is not appropriate in the social context, not appropriate in the cultural aspects, so this is particular the abnormality. So next we have there are four basic features, there are four basic categories, four basic parameters, four basic Ds that are defined through, that are given by DSM, the Diagnostic Statistical Manual of Mental Disorder. So what are they? They are deviance. The first is deviance from normal or healthy behavior. Simply deviate means a thing, a behavior, a emotion or any particular action that is deviating, that is going away from the normal. So this is the first general criteria of abnormality. The second one is distress. So any feeling of discomfort or uneasiness. Not only the discomfort, but when a person feels uneasy from innerwards or from the outerwards, the overall feeling is not appropriate. If the overall feeling is not okay, then it is also a second criteria to understand abnormality. So the third one is dysfunction. So simply dysfunction means if a person is not able to function well in their daily living, all the daily routine tasks in the daily living or daily functioning, their daily living actions, if the person is not okay, that means this is the third action, this is the third important feature that you can diagnose him, you can understand that there is somehow problems within the person. So the fourth criteria, the fourth number is danger. Feeling that can potentially lead to or cause harm to the individual or those around the individual. So if a person is having the symptoms, if the person is having the difficulty within self, so the person will create danger, the person will create somehow disturbance in their surrounding for themselves and to the people around the individual. So next we have, there is a picture, there is a flow chart with which we can understand, we can diagnose a person is having difficulty with abnormal patterns or not. So there should be a impairment, there should be a three basic disturbance in a person's life. What are they? First, distress. Patterns of feeling, thought, emotions. If there is disturbance, if there is a distress or there is impairment or there is a risk of harm. So these three factors, these three features will lead to a person towards determination of psychological disorder. Simply we can understand, we can identify if a person is having difficulties or distress in their emotions, in their feelings, in their behavior, or is there any impairment in their feelings, or is there any difficulty in their emotions, feelings, or there is a risk of harm. So we can diagnose, we can plan, we can find out that the person is having psychological disorder. That's it. Thank you so much.